Good morning. My name is Dr. José Zuniga, and I serve as President and CEO of the International Association of Providers of AIDS Care, or IAPAC, and the Fast Track Cities Institute. My sincere thanks to all of you for joining us for this workshop today. I'm also grateful for your tireless work prior to and since New York City joined the Fast Track Cities Network in 2016 during a side event at that year's UN General Assembly. Your innovative and pioneering work is inspiring other cities across the 500-plus Fast Track Cities network. For this reason, we honored New York City with our Fast Track Cities Circle of Excellence Award in 2022, and we continue to look in your direction as you model new approaches to close gaps across the HIV care continuum. I wish to thank Mayor Eric Adams, who with Deputy Mayor Ann Williams-Isom has maintained the city's political commitment and leadership as you strive to ensure that no person is left behind in New York City's response. I also wish to thank our intrepid colleagues at the New York City Department of Health and Mental Hygiene who have engaged in synergistic work with Fast Track Cities colleagues to advance mutual objectives. Significant progress has been made in New York City, yet much work remains to ensure equitable access to HIV prevention and treatment, person-centered care, and social support within the context of an environment enabled to respect every person's dignity. As you are aware, multi-stakeholder HIV commitment and leadership is critical, including in relation to political determinants of health. But of equal, if not more important, is meaningful community engagement that places people at the center of the HIV response. And I am pleased so many of our community partners are in the room, including those addressing social determinants of health, such as housing. We are gathered at this joint EHE Fast Track Cities workshop because we share joint commitments and targets. That is why EHE and Fast Track Cities are well aligned and synergistic. But while these commitments and targets are important to catalyze movement, ultimately, we must strive for every city to be on a trajectory towards getting to zero new HIV infections and zero AIDS-related deaths. As the midterm approaches for the AIDS-related Sustainable Development Goal, and 1 year from the EHE deadline of reducing new infections by 75%, we have our work cut out for us. In closing, I acknowledge my colleagues leading the federal EHE initiative with which we are partnered to end the U.S. HIV epidemic by 2030. I am proud of our partnership. I also wish to acknowledge ViiV Healthcare for their support of the series of interjurisdictional workshops across the country, but also for their long-standing partnership with IAPAC and the Fast Track Cities Network. And I would be remiss not to invite New York City to join us at this year's 10-year anniversary of the Fast Track Cities Initiative, which will take place October 14th to the 16th in the city of Paris, when it all began. Please join us at this pivotal conference and share your best practices and experiences with the wide network of Fast Track Cities. With that invitation extended and my deep gratitude for your commitment, I wish you a successful workshop and look forward to hearing about your ongoing successes in New York City.